Hello everyone. Today we're going to answer one simple question. Is mouthwash absolutely necessary? And I'm going to go ahead and give you the short answer, which is no, it is not necessary. However, there are situations when it could be extremely helpful. But more on that later. Now, let me explain my thinking. Well, let's start off with the core principle. Mechanical removal of plaque by brushing and flossing is always going to be the top dog. That's the first line of defense. And it's kind of like the engine of your car. You're never going to get anywhere if you don't have an engine. And then mouthwash is like the wax on your car. It doesn't help your car run, but it adds an additional layer of protection and maybe a little extra shine. And I know what you're thinking. What about the advertisements? All those ads showing us that mouthwash replaces brushing and flossing. Well, they're not telling the whole story. Sure, mouthwash might replace brushing and flossing in the sense that you won't get in trouble with your dentist for using mouthwash instead of brushing. But you're definitely missing out on the main dish and going straight for dessert. Now, let's talk about the two main types of mouthwash: therapeutic and cosmetic. And this is the most critical distinction I want you to take away from this entire video, because it will help you make the right decision for your own oral health. Let's start off with therapeutic mouthwashes. These are the guys that have active ingredients that actually help prevent or treat specific oral health conditions. They're regulated by the FDA as drugs, and they must undergo rigorous testing to prove that they work and support the claims that they make. Some examples of therapeutic mouthwashes are a fluoride mouthwash that helps prevent cavities, chlorhexidine that helps reduce gum disease, or a mouthwash that contains essential oils that also reduce gum disease and kill bacteria that cause bad breath. But what about cosmetic mouthwashes? Well, they're not regulated by the FDA as drugs. Instead, they're considered cosmetics. And these guys are mainly designed to temporarily mask bad breath, otherwise known as halitosis, and leave a pleasant taste in your mouth. Some may contain ingredients that actually help control bad breath, but they aren't necessarily doing it to improve your overall oral health, like therapeutic rinses. They're just trying to cover up the problem. Kind of like putting perfume on instead of taking a shower. You can't rely on them to protect your teeth or prevent gum disease. Now that you know the difference between the two types of rinses, let's talk about which ingredients to look for. Remember, therapeutic rinses have active ingredients that actually fight specific oral health concerns. So make sure you read the label on the back of the bottle. Now, it's like reading the nutrition label on food. You want to look for the active ingredients and not so much the inactive ones. Now, if your goal is to fight cavities and strengthen enamel, look for fluoride, specifically sodium fluoride. That's the gold standard for fighting cavities. Fluoride helps remineralize weakened enamel and makes teeth more resistant to acid attacks from bacteria. And here's an interesting fact. If you're wearing braces or have dental bridges, you're at higher risk for cavities around those areas. So a fluoride rinse can be really beneficial if you have difficulty cleaning around those things. Now, if your goal is to kill bacteria and reduce gum inflammation, look for either cetylpyridinium chloride, which is called CPC, or essential oils. CPC is a great antibacterial agent that's been shown to reduce plaque and gingivitis. In studies, essential oils like thymol, eucalyptol, menthol, and methyl salicylate, which is found in Listerine, have also been proven to significantly reduce plaque and gingivitis. Now, these are all considered over-the-counter options. But there is another option that dentists sometimes prescribe, and that's chlorhexidine. Now, chlorhexidine is a powerful antimicrobial that's very effective at treating and controlling plaque and gingivitis. However, it's not without its downsides. Long-term use can lead to significant tooth staining, and it can also alter the taste of your food. So it's usually only prescribed for a short period of time. Oh, and one last thing, alcoholic mouthwashes can be drying and lead to more bacteria and bad breath. So if you suffer from dry mouth, you may want to look for mouthwashes without alcohol. Ones that contain xylitol or other moisturizing agents like electrolytes. Now, I want to share something super important for you. Your personal care is unique to you and your situation. There's no one-size-fits-all approach, and your particular needs will dictate what kind of mouthwash, if any, would be beneficial. And that's why it's so important to visit your dentist regularly, because your dentist or hygienist knows your oral health history and can recommend what's best for you. That being said, I can still give you a general idea of when mouthwash can be really helpful. And that's when you're at risk for oral health problems. So, for example, people who are at high risk for cavities, those individuals with a history of decay, poor diet, dry mouth, or other risk factors. Also, people with gingivitis or early gum disease, bleeding puffy gums, that can be a sign of gingivitis. That group can benefit from using a therapeutic mouthwash. So, now that you know the benefits of each type of rinse, let me tell you how to use mouthwash correctly. Because it turns out that the way you use mouthwash can affect how well it works. First of all, timing matters. Do not use a fluoride mouthwash immediately after brushing. You'll wash away the high concentration of fluoride from your toothpaste. Use it at a separate time, like after lunch. Second, swish for the full time recommended on the label. Finally, don't rinse with water afterward for therapeutic benefits. Especially with fluoride, you want it to stay on your teeth. Spit it out, but don't immediately dilute it with water. This video was meant to educate you on the benefits of using a therapeutic mouthwash. And there's still one unanswered question. Should you use mouthwash? Well, ask yourself why. If it's just for fresh breath, a cosmetic rinse is fine, but keep in mind that it's only a temporary fix. If you have a specific oral health goal, preventing cavities, improving gum health, that kind of thing, choose a therapeutic mouthwash with the right active ingredient that targets your concern, fluoride or CPC, or essential oils. The best person to recommend a mouthwash for your specific needs is your dentist or hygienist. They know your oral health history and can guide you in the right direction. Thank you so much for watching this video. I hope you enjoyed it and learned something new. Please subscribe to our channel for more content like this. And remember, your smile is your best accessory. Wear it with confidence.